Subcommittee on Health will come to order. I want to start off by welcoming all of the new members that are on our Health Subcommittee, and I look forward to working with our ranking member, Devin Nunes. I think we can have a productive beginning to this Congress. I have some brief opening remarks, and then I know Mr. Nunes will have some. We're very fortunate to have the panel that we do this morning to continue the exploration of prescription drug issues that we talked about only a couple of weeks ago here in the full committee. I was encouraged at that hearing to hear a number of comments from colleagues from both parties about the medication problems that each of us has been hearing from our constituents about. Today we have a special focus on the role that competition can play in bringing down soaring drug prices and on the multiple barriers deliberately constructed by the industry to prevent competition from working effectively. One such solution is ending the pay-for-delay settlements where brand name and generic manufacturers agree to anti-competitive deals that keep competition off the market. I've introduced legislation last session and again this time to prohibit this kind of behavior and to try to encourage more competition. I hope that this is an area that we can find common ground on. Our witnesses last month and again today offer more evidence of the reality that so many Americans confront where essential medicines that are there but they cannot afford them. And they either get those medicines with great difficulty by jeopardizing their financial health or they do without the medicines. Prices for the most commonly prescribed brand drugs under Medicare Part D have soared up to 10 times the rate of inflation. And this is a problem not only for the individuals, but for American taxpayers. The Medicare trustees expect drug spending to nearly double over the next decade. Unfortunately, there is no miracle cure for price gouging. While, as our witnesses explain, Congress should be engaged in a number of actions, I believe some of these are within our committee's jurisdiction that we'll hear about today, and some of them are informative but a little outside of our jurisdiction and require working with colleagues on other committees. I believe that the most important of those measures is to use bargaining power to lower prices for those who rely on Medicare, much the same way that the Veterans Administration has done for years on behalf of our veterans. When over 15 years ago, the Medicare prescription drug program, which was voted on in this committee, was narrowly forced through the House in the middle of the night after considerable arm twisting, one of the provisions that was inserted was a notable section that provided a complete prohibition against Medicare negotiation of drug prices. In 2007, every Democrat and 24 Republicans approved legislation to repeal that costly limitation, but not surprisingly, it was blocked in the Senate. Medicare negotiation is also the approach that candidate Trump recommended to save hundreds of billions of dollars through what he called bidding. And he pointed out the reason that we don't do this is, quote, because of the drug companies. Importantly, that 2007 bill lacked a mechanism for addressing what happens when negotiation is unsuccessful. The most common way of addressing that situation for a manufacturer who will not negotiate is to simply refuse to cover the drug, to exclude it from the list of approved drugs or what's called the formulary. That, of course, produces claims that a life-saving medication is being denied to someone who is relying on Medicare. And that's basically the argument that fills the multicolored ads in every Capitol Hill newspaper almost daily against the Trump administration's pending Part D proposal. So I've advanced an alternative to that, which we'll hear more about today, as a way of assuring that every drug is available, but some competition can hopefully bring the price down. Unwilling to yield their monopoly power, we also hear a number of scare tactics that insist there is no way to have reasonable prices and still encourage essential innovation. Our witnesses today can respond to those arguments. I think all of us want to encourage cures and treatments for dread diseases before we get them ourselves or a member of our family or a loved one or a friend. Despite the immense lobbying power, despite government-funded research, despite monopoly profits, Big Pharma, I believe, has actually not done a very good job on innovating and providing the medications that we need. It's seldom worried with a competitor, and so monopolies and oligopolies are not known for their innovative spirit. They're not known for that quality in any industry. Over the last decade, 74% of all pharmaceutical patent applications were not for new innovative cures, but were for modifying existing drugs, which often took the form of what's referred to as evergreening, simply to protect monopoly pricing, not to provide new drugs. And taxpayers have been funding a significant amount of this research. From 2010 to 2016, every single newly approved drug relied on taxpayer-funded research. The taxpayer pays for the research, the government approves the monopoly, and unlike other modern countries, the pharmaceutical company faces little or no restraint on the prices that it charges. During the last year, Big Pharma has changed its approach from denying that there is any problem at all to pointing the finger at everyone else in the supply chain. Strangely, I've heard Secretary Azar, who I hope will be before our full committee over the budget in coming months, claim that Medicare negotiation is not necessary because Part D insurers are already so adept at negotiating, and then turn around and blame price hikes on the prescription benefit managers who do the negotiating. We do need to examine the practices of these PBMs, and they may well be contributing to some of the high prices experienced by consumers across the country. But without addressing the manufacturer who sets the price, I believe we'll still have too many people having to cut their pills when prices are not cut. I believe we have a responsibility to ensure that patients come first and that it is their health and livelihoods that are the only thing that is non-negotiable. Unaffordability and inaccessibility are not the unavoidable side effects of innovation. They're a result of unrestrained monopoly power. I thank all of our witnesses for joining us today to examine these issues and welcome the comments of our ranking member, Mr. Nunes.